Dr. Wendy Coburn here at One Village Family Chiropractic Studio here in Edmonton, Alberta, and just talking to you about the importance of a chiropractic adjustment in the upper cervical spine, mainly about which nerves it is impacting and connecting to. So I'm not going to go through everything, but you can see a lot of important nerves are happening and the connections through there, and these are the cranial nerves. So it impacts our sense in our sinuses, it impacts our eyes, it impacts the muscles coming in and around the eye and how the eye is moving, right? Trochlear nerves, oblique muscles, abducens coming through there. The trigeminal nerve, it comes into the, can come around the eye and into the jaw. There's lots of individuals that have severe trigeminal pain coming into the face and not pleasant whatsoever. But it impacts sensory, face, sinuses, teeth, orbit, oral cavities, and the dura, the lining of the skull and the spine, and super important in chiropractic and sacrooccipital technique, which we use in our office here. Some of the cranial nerves also coming out of the brain stem come into the muscles, into the cheek and the jaw on the side of the skull, so impacting chewing and jaw control. We also have the facial nerve coming again, the muscles of the face, posterior belly of coming into the bottom of the chin, stylohyoid, muscles at the base of the skull as well. And nerves coming into the motor branch and the submandibular, coming into the tongue, taste anterior 2/3 of the tongue, and palate also coming out of that brainstem, coming into the ear, coming from the brainstem on the lateral side. Glossopharyngeal, taste, sensory, and motor coming into the parotid gland. All those things are crucial as well. And the vagus nerve, we have so much research about the vagus nerve right now, which is awesome. It is not the only nerve in the body, but it's hugely important because it does impact so many things, all the way from the brainstem all the way down to the pelvic floor. It's one of the controllers of inflammation in the body. It can impact rest and digest, the parasympathetic brake pedal, if you will, of the nervous system, which compromises 20%. It has a motor branch to the heart and lungs and palate and swallowing, right? And larynx and trachea and bronchi, GI tract, sensory, heart, lungs, trachea, and even into the external ear, right? It's huge. And super important in people that are struggling with fight or flight and freeze in their nerve system. This is helping and supporting wake that parasympathetic branch. Other parts of the nerve system coming in, the accessory coming into the SCM. Some people get torticollis with this, coming into the traps constantly being tight, and people saying, I'm tight all the ways across the top of my shoulders, potentially shifting and stemming from this area, and other muscles coming into the lower jaw and the neck here as well, with the hypoglossal tongue muscles as well. So lots and lots of nerves coming out of the upper cervical spine. It is crucial to help with how the body is functioning and control and coordinating of motor and the basic necessity of life in our kiddos when they're born, for latching and swallowing is super important. And this is an area in the upper cervical spine that sometimes can get subluxated or under tension or stress during pregnancy or the delivery process, but also can impact everything above the neck as well. So it's absolutely something that you should have checked with everybody at every age for wellness in the spine and the nerve system, to allow your body to function and heal and recreate at its best, because health comes from within, not outside in. Have an awesome day. If you have any questions, please reach out, but please like, follow, and subscribe to us here. Thanks.